Hi, everybody. Thanks for joining us today. Really excited for the panel that we have to talk about the data-driven COVID outreach campaigns. A couple quick reminders to kick things off. Hopefully everybody can hear us and they're streaming audio either through the app or through the dial-in numbers. We have a Q&A set up through the questions tab, so feel free to ask questions as we go through the presentation, but we won't actually answer them until we get to the very end. We'll collect them up. It's quite possible, because we have a really full agenda today, that we won't get to all of the questions, but when we send you the presentation in the email later next week, we'll make sure that we get to answering the questions in email if we can. If you have any technical issues, jump in the help tab and we'll be happy to help out. Otherwise, you can always follow up with us afterwards at hello@civisanalytics.com. With that, let's go ahead and kick things off. My name is Aaron Williams. Abdul, you can go to the next slide. I am head of Civis's marketing group, and really excited to be here. Go ahead and go to the next slide. I'll introduce our three panelists. First, Crystal Sun, director of our healthcare analytics here at Civis, and certainly the person that we turn to when it comes to hard questions like how do we use data with these vaccine campaigns. Next, Alex Hans, deputy press secretary for Governor J.B. Pritzker in Illinois. Really happy to have his perspective and a great partner that we've been working with on this challenge. And then last but not least, Christine Campigotto, the Vice President of Research and Impact for Made to Save, another partner of ours. And Christine's a former member of the Civis clan, so we're happy to have her join us as well. I'm not going to actually jump into the fun facts, although they are pretty fun. And if anybody speaks Italian and wants to follow up with Alex later, that would be awesome. But we're going to go straight into the content. And with that, I'll hand it over to Crystal. And like I said, I'll be monitoring the Q&A for later.
Thanks, Aaron. And thank you to everyone who's taking the time to join us today. We're really excited to share some of the information that we have from our message test that we just wrapped up this week, as well as some guidelines and principles for doing data-driven COVID outreach. So as Aaron mentioned, Alex, Christine, and myself come from three different organizations, but we have been working closely together for the last year in the case of Alex, and several years in the case of Christine. Some of the past projects that we've worked on that have also had the mission of data-driven outreach in mind include reaching hard-to-count populations for the US 2020 census last year, connecting women at risk of breast cancer in Chicago at risk with free mammograms offered by the Chicago Department of Public Health. And then in the last year, a messaging campaign directed at the public, encouraging them to wear masks. Next slide, Abdullah. So today we're going to talk about how to maximize the reach and efficiency of your COVID-19 outreach. And we're going to use this 5-step approach as a guide. This is something that Civis often turns to, and we use this as a way to structure our thinking around outreach. So whatever the outreach mission of the organization we work with may be, we generally break it down into 5 different steps. One is to identify the key population that you want to reach and describe who's in it. 2 is to understand what this population believes, wants, and needs. 3 is to test different ways of reaching out to that population, whether that's messaging or another mechanism of outreach. 4 is to implement, so to actually put it into action. And then 5 is to measure throughout. So when we get to step 3, we're really excited because, as I said, we're going to share with you a snippet of results from a message test we wrapped up just this week, where we looked at different ways to talk to groups that, according to the data, are more vaccine hesitant than others. And we want to provide you with research-backed guidance on what to say, and also, more importantly, in some cases, what not to say. So I want to make one note before we dive into the presentation, though. So throughout today's talk, you're going to hear the term vaccine hesitant, and it's become a commonly used term to refer to many people who are not yet vaccinated. Much of today's presentation is going to focus on key messaging and persuasion as well, but we want to make sure to acknowledge that when we use that term hesitant to refer to this group, it implies that persuasive messaging is all that's needed, and we want to make sure to call out that messaging is a necessary component of your outreach, but it's not sufficient. So you have to also pair messaging with things like logistics and ensuring that barriers to access are removed. Next slide, Abdullah. So with any kind of outreach, you want to be able to first identify and articulate who your key population is. So who do you want to actually reach out to and who's in that population? When it comes to COVID vaccine outreach, we've found it helpful to think of at least 3 different segments. First, you have the early adopters, and those are folks that are already on board with vaccination. It's very easy to do outreach if you have to do any. Actually, there's a high demand there. 2 are the people who are more on the fence. They're sometimes called the movable middle. They're unsure about vaccination. They want to wait and see. They have some competing priorities that are barriers. And then 3 are the likely refusers. So these are the people who are just more hardline, not open to vaccination. They're strongly opposed. And the reality is they may not ever be on board with vaccination. So stratifying this way allows you to deprioritize the early adopters. There probably isn't a lot that you should do to expend your energy there. Maybe even deprioritize likely refusers as well and focus on that middle group of movable middle. Again, how you stratify your population is entirely up to you, and it depends on the constraints of your organization, but this is something that we found to be helpful. It's a way of thinking about this population. So some of the data to describe some of the people that fall into this middle category, we wanted to share with you. And for many folks on the call, it's probably not going to be new information, but as of late April 23rd, 2021 to be exact, about 36% of Americans we find are either not sure, they're 10% of that group is not sure, or they said that they would absolutely not get vaccinated. That's about 25%. One thing to note is that we do see hesitancy across the US going down, which is good. So willingness is going up. But especially as vaccines have been rolled out to a significant proportion of the population, it's important to pull out the people who have been vaccinated already and look at the remainder of people who are left. And if you look at just that population, there is a increasing hesitancy in that group, which is to be expected. So if those vaccinated people are removed, it's about 56% of people who are either not sure or have said that they would not get vaccinated. In terms of where they're located, we see a higher concentration of these folks in the Midwest and in the South and in rural areas as opposed to suburban and rural. And then compared to the general adult population, there's a higher concentration of the folks in this list. So Black and Latino people, people with less than a college degree, people under 50 years old, people who make under $50,000 a year, and people who identify as Republicans. Next slide. Okay. So for the state of Illinois, we have been working with them, like I said, for the last year on increasing vaccine and COVID-related public outreach. This is one of the groups that they wanted to focus on, which is called also the movable middle. So Alex, do you want to talk through some of the differences between the movable middle versus the general population of Illinois, and if any of these stats were surprising to you?
Sure, thanks, Crystal. We wanted to focus on the movable middle just to be efficient with our resources and always make sure that we're following the persuadable folks in our state. And what we found back in December when we were, the vaccines were first becoming available and we're doing the first plans for the campaign is that more people were likely to be younger, female, lower income, and Black. And, we started to create the campaign at that time, but also knew that that group was going to change pretty rapidly. So we also set up, a series of surveys so that we could measure that as time goes on and refocus our messaging. So if we could go to the next slide, we could actually see that, the movable middle was 46% of adult residents in Illinois, and it's shrunk to 26, which is great to see. We also seen refusers go down from 15 to 12, which was heartening. And we're using these metrics not only to measure the success, but also to understand who we're speaking to, and the composition of that group changed, and it's skewed even more towards younger adults, and the differences that we saw at the outset with race and gender have actually balanced out. So we're taking all of those new data points in and restructuring the campaign as we go along.
Great, thanks. Next slide. So the next step in the approach is to understand what the population believes, wants, and needs. So we've already done the description of what they look like demographically, geographically, but now we want to dive into some of those more social science aspects. So next slide. So we generally think about beliefs, wants, and needs, and we ask a whole battery of questions, and wherever we can, we turn to the data that we have available at our fingertips, either if it's compiled by ourselves or compiled by outside research partners to come to an assessment of what the population looks like from these perspectives. It's really important to invest the time to look at the data and spend some significant time here in this stage of the process. It's also important to not over-calibrate to what we think in terms of gut instinct, what we hear about through anecdotes, what is the most widely circulated headlines about who your target population is, and really take as much of an objective look at the data as possible. Christine, I know for you at Made to Save, there, when you first started in the position, there was a question of whether you would compile research yourself or if you would refer to a lot of the great publicly available research put out by other organizations. When you look at how the quality of that research and who's putting it together and how they've done it, how do you make that assessment of what to go with and what not?
That's a great question. So at Made to Save, we're focused primarily on communities of color and the communities that have been hardest hit by the pandemic. And so something that's really important to us and to me when thinking about what research is applicable to our work and to our partners is the extent to which it offers the ability to look at the data among those communities specifically. So being able to disaggregate different racial groups and in particular, some of the more marginalized communities that are often not looked at in survey research. We think about Pacific Islanders or indigenous populations. And so that's a really big key for looking at what research from the publicly available research we can use or where the gaps are that we might fill. Beyond that, I look for, of course, like good sizes of sample and methodologies that, made sure that they were random and that, that the survey was kind of conducted in a statistically rigorous way. And then when it comes to messaging, thinking a lot about, and I know not to jump ahead, but thinking about, are we testing messages in a way that's robust and not relying on people to self-identify messaging for themselves.
Yeah, that's great. Next slide. So the next couple of slides just offer a very small sample of some of the insights, the questions that we've asked of the data and some of the insights that we've pulled out under these categories of knowledge and beliefs, needs and wants. So we pulled from a couple different sources. We have a national data set that goes national survey that runs every week. We also have been working with Alex and his team and have done substantial public opinion research in the state of Illinois. So you'll see both sources reflected here. So in terms of what they know and believe, we wanted to ask questions like, now that people are fully eligible for a vaccine, how many people actually know that? And nationally, we see about 11% of adults are still not sure if they're eligible. This is a pretty recent announcement, so we expect that number is going to go up. We certainly want it to go way up, more up than 11, to decrease. We want that uncertainty to decrease. We also asked in Illinois, what are some of the, not just barriers, but motivators of vaccination? And you can see some of the reasons listed there. And then third, we wanted to dig in deep pretty early on into, if people are resistant to the COVID-19 vaccine, how correlated is that to just having general anti-vaccination attitudes. And one of the things that was kind of surprising to us is that the movable middle does not, and even the likely refusers don't have completely anti-vaccination attitudes. So there is something unique and different about the COVID-19 vaccine. Next slide. Alex, this is from the state of Illinois describing who people want to hear from, whether it's doctors, public health experts, or people who've experienced COVID-19. And I think one of the surprising things here was that third row, right? The people who've experienced COVID-19 themselves, because there's a lot of guidance out there saying that people trust doctors, they love scientists, they should be the number one and only messengers of this kind of information about the vaccine. Was this surprising to you?
Honestly, when we were, speaking internally, it was pretty clear that people have a wide range of people that they look to for information. So it was definitely surprising to see that, there was an erosion this large. We had probably an inkling there. But what was also surprising is, we tested, like 12 different messengers, and these are the top ones. So even people like religious leaders or, government officials, I guess, isn't super surprising to not be completely up there. But, that this group of people is the right group to reach both the middle and the refusers.
Awesome. Next slide. And then in terms of what they need, sort of hearkening back to my earlier comment about it's not just persuasion, but it's also about the logistics and meeting people where they are with what they need. We've asked a slew of questions ranging from transportation, English language assistance, and this is an example of something that we fielded at the end of December. We knew that particularly with 2 of the vaccines that had been authorized, the compliance with the second dose, there would need to be a focus on helping folks make sure that they get their second dose and get it on time. So we asked a question about, what would help you get that second dose? Would it be a text, an email, phone call, or that sort of thing? Next slide. The third step in the process is to test different ways of connecting with your audience. And like I said, we're going to focus a lot on the message test results here. Next slide. So we find working with a lot of organizations that they have sort of trusted go-to methods for how to assess how they're going to talk to the public, how they're going to frame their messages in a way that's most convincing. And 3 of the common strategies are listed here. One is, if you can really call it a strategy, is just to use what's been used in the past and has been successful. 2 is to rely on focus groups. And 3, which is really common, especially nowadays, is to conduct a survey. One thing I'll note is that there's nothing inherently wrong with these 3 approaches. There are just some limitations, some strengths and weaknesses to be aware of as you collect this type of data and refer to it as you develop your strategy. Next slide. So one thing that we did a couple of years ago was to test different ways to talk to folks about getting them on board with flu vaccinations. In a lot of ways, flu vaccine can be thought of as similar to COVID. It's a respiratory virus. Transmission is sort of similar. And so it can be very tempting to say, like, this worked for flu, let's try it for COVID-19 vaccine outreach. In our flu vaccine message test, we tested 3 different messages. They're called altruism, personal story, and big sad numbers. And we found that the message we called altruism was the most persuasive. It resulted in an average 8% increase in a probability that a person would come back and say, yes, I would get the flu vaccine. The altruism message focused on, the importance of getting vaccinated because it helps people who are either higher risk or they can't get the vaccine themselves. And by you getting the vaccine, you're helping to protect them. But what we find is that over and over again in the message tests we've run with COVID-19, the messages that have these similar themes of protecting the community, protecting people who are more vulnerable, are way less effective than messages that emphasize the personal benefit. Next slide. Another common strategy is to rely on focus groups. And focus groups are great. They're a good way to start building your hypotheses. The two-way conversation allows for going really deep on a select number of people. You can get that feedback from the people who are participating. But the limitations are that it's a very small group. So how generalizable those conclusions are to a general population, that's usually limited there. The data collection process is usually a lot slower. It can be very costly and something to consider if you want to do repeated measurement over time. And then last of all, there are some biases that focus groups are more prone to than other data collection methods, including groupthink, which just means that if you're in a group setting, you we tend to see this phenomenon where people start to have similar conclusions. Observation bias, which means that you tend to change your responses because you're being monitored. And then social desirability bias, which is kind of a flavor of that, just refers to people knowing that they should answer a certain way, and so they sort of tailor their responses accordingly. Next slide. There's no shortage of survey data on vaccine hesitancy, especially lately. A lot of that is being developed and published by Civis, actually. So, that it is a very common and another great method, but we want to make sure that one of the key takeaways of our presentation here today is that surveys can't be the end of the road. You have to actually go forth and test your messages after that. One of the things that we see over and over again in our surveys is that if you ask people what their biggest reason is for declining the COVID-19 vaccine, and in fact, we see this with other vaccines as well, is that they're afraid of they're worried about safety. They don't think the vaccine is safe. You could even argue that the second and third bars are also safety related too, which is, I'm concerned because the vaccine hasn't been tested on enough people like me, and I think I'll have really bad adverse side effects after I receive it. So naturally, if you looked at this data, you can see how easily it would lead you to conclude that if you're going to message COVID-19 vaccination and the importance of it, you want to talk about, let me tell you everything about how safe the vaccine is. That's going to be my leading strategy. The problem is, the next slide, when you actually test a message that talks about safety and how the FDA approval or authorization process didn't cut any corners, it was just faster, there's a rigorous independent review, that's actually the message that we find at best is ineffective, or in some cases it leads to something called negative backlash. Negative backlash is the probability that somebody is going to be less likely to say that they're willing to get vaccinated than if they had not seen that message. There are a couple different reasons for this. One is that in a survey instrument, you're not really asking them what would persuade you. And in fact, even if you did, people are generally not very good at identifying what is the most persuasive message for them. That's why it's important to do the testing. I think another reason could be that there's so much conversation about safety and side effects that becomes just kind of a natural answer for people in a survey instrument to choose. Next slide. The way that we do message testing is different in that we're not just asking people what would be what would remove the barrier, or what would be the biggest motivator for you, and then tailor a message that way. we set up a randomized control experiment where we're testing different flavors of a message that all talk about the importance of vaccination. And each person who participates in that experiment is randomly assigned to see one of those messages. Before that happens, though, they're asked a series of pre-screening questions. So we ask about basic demographics, but we also ask about things like previous COVID vaccination or COVID diagnosis, so if they've had COVID themselves, if they know somebody close to them who's had COVID. And then we ask them post-message questions, the most important of which is a question asking them about how willing they would be to get vaccinated. And then the last step in the process is to run a statistical model that controls for some of the respondent characteristics. So at the end of the day, our goal is to provide you with a set of results that more objectively says the reason why we're seeing some of these persuasive effects due to this message is really due to the message and not because respondents are different from one another in your experiment. Next slide. So this week we fielded a message test and it involved 4,215 US adults who belong to at least one of the following 6 groups that, according to the data, have had higher uncertainty about vaccination. These are the same groups that you heard us allude to earlier in the presentation. Next slide. And these are the 6 different messages that we tested. Like I said, each one of them has the same core theme, which is you should get vaccinated. But the flavor and the tone of that message varied. So the first one was what we called back to normal. So it emphasized that getting vaccinated means you can return to a normal life. There also may be some things like traveling that you'll either have to wait longer for or might not be able to do because you haven't been vaccinated yet. Number 2 was our good old safety message. So we wanted to include this because trends change and attitudes have definitely changed about COVID vaccination. And we wanted to see if some of our former conclusions about this message being ineffective still held true. Third was called Scary Stats, and it talked about some of the cases of long COVID and how getting the virus itself is a much scarier prospect than the risks of the vaccine. Fourth is personal story. If you're familiar with any of our previous message tests, you may recognize that we tested this message framing as well. In this case, we did change the story itself a little bit, but you know the framing of it was very much the same. And the emphasis here was that COVID-19 can have serious impacts on a young, otherwise healthy person. The 5th message was called patriotism, and it talked about how getting vaccinated is the ultimate definition of freedom, liberty, and country. It talked about being born in America and how this is really a victory for American science. And then the last message, which was called personal decision, really was emphasized that getting vaccinated is your choice. You should get access to all the information that you need, speak to people you trust, but ultimately it's your choice to get vaccinated. So I'll stop here and ask you all if you have any instincts, any spidey sense for which message you think or messages you think were the most effective and which ones were the least effective. I don't think we have a voting function, unfortunately, so we'll just have to think about your answer and then keep it in mind for the next slide before we reveal the results.
Yeah, I was gonna say, like, everybody be honest now, like no changing your vote after you see the results, like, but yeah, everybody lock in what you think the right answer is, and we'll have the big reveal.
Okay, I think everyone got it. Let's go to the next slide. All right. So what we found is that the most persuasive messages, there were two of them, were the getting back to normal and the personal decision messages. So a quick note on how to read these figures, because there's a couple of them in the next slide, next couple slides. The vertical dashed line refers to a baseline. So that comes from the control group, which saw no message. And then each of the colored horizontal bars refers to a separate message. So you can see that getting back to normal at the top is represented in that sort of like medium blue color. The number is the number of persuasive points, you can think of it that way, of that message over the baseline. And if you see that horizontal bar does not cross the dashed vertical bar, that means that the finding was statistically significant. So here in this case, you can see bar number 1, which is getting back to normal, and bar number 4, which is personal decision, were the most effective. So what we find that what's not effective is emphasizing safety. Again, scary stats or patriotism doesn't seem to work. One thing that is interesting is that personal story also didn't seem to work from our testing this week. And this is a contrast from last year in August 2020 when we ran that other personal story message. There are a couple of thoughts on why. One is that simply August 2020 was a long time ago. Thoughts, attitudes, the state of vaccination has changed dramatically since late summer. In August, we were talking about a hypothetical vaccine that people didn't know really that they were going to have actual access to in just a matter of months. The other thing to note is that our August 2020 message test was directed at the general population. And in this case, we're specifically targeting vaccine hesitant groups. And so we're not surprised that we would have a different finding for the test and for the personal story message in this test. Next slide. So that's overall. When you look at specific subgroups though, it is important to look for where you may have a message that performs really well on one subgroup and not another. And before you run your outreach campaign, taking a hard look at who it is, again, that you want to reach out to, and are they comprised more of one subgroup than another? So in this case, this is an example of how one message can perform pretty badly for one subgroup, which is the personal story message. You see that represented as -5 percentage points for males. But for females, it's a pretty neutral effect. It's 0% and it's not statistically significant. Not that that's everything, but that is something. Next slide. And then again, some more subgroup effects examples. This is persuasion by race. So we found that is the personal decision is effective, but more so for white Americans. And that's represented by the +6% bar at the very top of the chart here. And then the personal story is most likely to backfire with Latino and Latina Americans, which is the 4th box down, the +3%. Oh, I'm sorry, the -4%. Next slide. So in summary, for specific subgroups that are prioritized for COVID-19 vaccine outreach, we just wanted to create one handy dandy place for people to refer to. The top 2 performing messages were back to normal and personal decision. Back to normal was especially effective with men, people who make an income over $75K a year, people who identify as Roman Catholics, people that are have stated that they get their news primarily from public radio, MSNBC, Wall Street Journal, and TikTok subscribers. And then the personal decision message was especially effective with Republicans, white Americans, people that watch Fox News, and then all 4 of those messages in the middle were not significantly persuasive with any subgroup. And we wanted to call out that the personal story message was particularly backfired with male respondents. Next slide. So those are our messages or our results from this specific message test. But we're constantly looking back at all of the testing that we've done to date and collecting if there are any recurring themes or meta insights that we can provide to you. And what we find is that in terms of what messages work, talking about vaccination can get our lives back to normal. That seems to be really effective. And that's in fact something that we first picked up on when we were working with Alex and the state of Illinois team, right? This can be a message about how vaccination helps us get back to school, church, or recreational activities like going to the movies. What also seems to work is just encouraging people to inform themselves and guiding people to make their own decision instead of directing or urging them. This is not something that we had seen a lot of in the past, but it could be due to many different reasons. One is that, again, attitudes change and the shifting demographic of who are the remaining unvaccinated people now that vaccines have been rolled out and taken up by a significant portion of the population. And then third is talking about the effectiveness of the vaccine in a straightforward way. We find that talking about the statistics and the scientific rigor of the clinical trials tends to be something that is not very persuasive. One note on this is that we have seen differences in who is delivering that message and how persuasive that message can be. So for instance, we wrapped up a message test in late February looking at if an employer talks about effectiveness of vaccine, is that persuasive? And that's not. But if you have a general voice, presumably, I think if you have a person who is trained in medicine or science talking about some of these more technical scientific concepts, that could be a good strategy. And then in terms of what messages don't work, we've said this over and over again, and today's message test findings only confirm this, that leading with messages describing how safe the vaccine is, how it's been tested extensively, or citing the FDA approval process doesn't seem to be very effective. So our recommendation is that we really think about how to decouple the messages about safety from effectiveness, because if you can persuade people by talking about effectiveness, then you don't want to water that down with talking about safety. It doesn't mean that you can't, it doesn't mean that you can avoid the conversation about safety altogether, because people are going to have follow-up questions. But we want to emphasize that leading with this message straight out of the gate, as the survey data would probably suggest that you do, is not something that we recommend. What also doesn't seem to work, again, I mentioned this before, is messages about getting people vaccinated because it helps others. Personal benefit seems to be much more persuasive when it comes to COVID messaging. And then last of all, the scare tactics and fear-based messaging, we've seen that it can have negligible effects and in some cases could lead to negative backlash. I'll note that the personal story from last year, as well as the personal story this year, did have very much of a tone of COVID is very scary. It can have lasting impacts. So that could be one reason why we didn't see very much persuasive effect with the personal story, especially this time around. Next slide. So coming back to our process, the next step is to implement or take action. So next slide. We're really excited to have Alex and Christine walk through some real life examples of the creatives that their organizations respectively have created and are sharing with the world. So Alex.
Thanks. Yeah, so we did our own message test back in December, which really honed in on the same topics that we're seeing reinforced nationally and, by other organizations, and that, talking about effectiveness and getting back to normal are the ways to go. And, when we looked at our messengers, it was public health officials and doctors, like we have Dr. Ezekiel, our director of public health, and Dr. Marina Del Rios, who's an ER physician. They're the top trusted group, but we also wanted to diversify and, get people who have experienced COVID, like Julie Sparks, the second woman here, who was a contact tracer and also a caregiver to her 78-year-old mother. They both had COVID, and she just has a wealth of knowledge to share and perspective. And then also Judd Ross, our guy in the end, his whole family had COVID, and it just takes a we wanted to really bring seriousness, severity, and hope in these messages, and have it be authentic from the voices of our residents and the people who could actually persuade. So we could go to the next slide to see a preview of one of these ads.
Getting vaccinated made sense. This is the tool to help us get back to living life.
And that's a short one, just because I know that we are tight on time today. But we have, dozens and dozens of ads running at one time. In total, probably, over 100 over the course of the campaign, which is going to run many months. So I think the next slide touches on some of the other materials that we've developed. We, want to make sure that we're sharing these insights as well. They're only as useful as, they're accessible to people. So we, made a couple different resources. The first one is more resident focused, explaining the process of getting vaccinated and obviously highlighting all of the messaging that we know is going to be effective. And then we created a one-pager for community leaders and organizations, which then got developed into a whole presentation to help train community ambassadors so that they are also, taking these insights and using them in their individual conversations, and especially when they're able to go deep, that they know how to navigate conversations and, use the best tools in the toolbox. We could turn it over to the next slide, and Christine.
Great. So at Made to Save, a lot of these threads of messaging, I think, play out in the way that we talk about ourselves and the calls to action that we use, and even the name itself, Made to Save, focuses on made to save moments and things that we all miss the most. So that's very core to the way that we talk about the vaccine. I mentioned earlier that we're focused on communities of color, and I think it's important to think about when we talk about getting back to normal or what we miss or getting back to those moments. For some people, it might mean if we all get vaccinated, the CDC restrictions will lift and stores will reopen and the gym will reopen. It might mean that, but for a lot of people, it means, in Black and Latino people, 30% of Black and Latino people have a family member or a close friend who has died from COVID. And so getting back to normal means getting back to being able to spend time with friends and family and not be afraid of the impacts that the virus is going to have and the far-reaching impacts of this pandemic. And so when we think about this, we really think about trying to lead with hope and optimism for the way that the future can possibly be a little less scary than the past year has been, especially for some of these communities. So I think this is a video, right, that we'll be able to play, and this is a video that our launch video.
It was made to save game nights and marquee lights. Tuesday Night Live, Good Vibes, and The Sunday Drive. It was made to save family meals, turkey naps, and taffeta. It was made to save 9-to-5s and just being able to provide. It was made to save the lifesavers. It was made by the best among us to be effective. The COVID-19 vaccines were made to save. They were made to save us.
Great, thank you. And then I think if you're able to get back to the slides and go to the next slide, and then just wanted to call attention here when this is our homepage, something that's really important to us and that we do a lot, and I think is the messaging, this test and this survey research helps reinforce is that our first call to action is always learn more about the COVID-19 vaccines. So then, our third one is find out how to get vaccinated. So like, if you're interested, find out how, but first learn more. And that's kind of rooted in this place of starting from a place of empathy. A lot of this, in addition to this message test that Crystal just went over, this is something that the Ad Council has also done a lot of research and found that the idea of like empathy, acknowledging that people have questions and concerns, not force feeding it, so to speak, being really important. And so that's another really key point there. And actually, one thing I just want to say about the message test that was really surprising or heartening to me is that even just a message about getting information and asking questions, that message didn't actually even tell people to get vaccinated. It said, you have questions, you should get answers. Even that made people 5 percentage points more likely to get vaccinated, even before they had asked those questions and gotten those answers. So even just creating an environment where it's acceptable to be unsure, where it's acknowledged that these questions are valid, is a place where people feel more comfortable moving forward with the vaccine. I think that's all we have from my,
That's a great point, Christine. And just want to highlight that I mentioned that the core theme across all 6 messages was you should get vaccinated. But for that one in particular, it was not explicitly stated you should get vaccinated. It was more just like the tone of the message, and it more emphasized the exact points that you were mentioning. Next slide. So one of the ways that Civis is working with organizations to help put these insights into practice and fuel their vaccine outreach is we created a set of tools that we call Vaccine Outreach Intelligence Center. And it refers to several different vaccine predictive models that our data scientists have created, as well as a software application. You can see a screenshot of it here. This is for the state of Illinois, that allows people who are on the front lines of outreach to visualize areas that they need to target, demographic groups, and then incorporates those insights as well as any data that they bring to the table so that they can see it all in one place. I should mention that this slide deck is available for any of you who are interested in seeing it. You should just, you can just email to hello@civisanalytics.com, and there's a hyperlink in the title here. Next slide. So last of all, the last step in the process is to measure campaign effectiveness throughout. And this allows you to monitor how successful you are at your outreach campaign. And then if you need to, you can pivot or readjust as needed. Next slide. There's just a couple of outcome measures that we track and we help organizations who partner with us track. One is, of course, the vaccination status. Another could be vaccine hesitancy. Just some guidelines for when you are choosing an outcome measure to track. It's not a one-size-fits-all approach. Really should gauge your own abilities and constraints of your organization. But data should be consistently collected and readily available to you. So a lot of times that means when it comes down to brass tacks, no major delays in data, not really untenable hurdles to try to acquire that information and bring it into your ecosystem. Two, ideally, outcome measure data should be viewable in the same location as some of the data describing your program. Just makes the feedback mechanism of taking action and then getting insights back from the field on whether it's working much more sustainable. And then third, trends in those outcome data should at least be indirectly attributed to the work of your campaign. So if you're acting locally, you can, of course, look at national data on vaccine hesitancy and vaccination status. But the further you are removed between your outcome data and your action data, the harder it's going to be able to, harder it's going to be for people in your program to say us moving the needle on the outcome data is due to the actions of our program or not. Next slide. So I think we are ready for some Q&A.
Yes, that was great. So thank you all. First, super impressed that we made it through with some time to spare to do Q&A, because I have to admit, I was a little skeptical that we were going to make it through all that, but that was really great. I think you did a good job of encapsulating all of those steps and kind of walking us through it. I do have a few questions here. I'll start with one from This Is Our Shot. And first, they wanted me to thank you all for your helpful insights. Of course, that comes from all of us. You guys did a great job. But the question here is, have you explored the word normal in the getting back to normal message? So they've seen some data and heard some experience that word normal may not be the most optimal because many people didn't like the previous normal. So they've been using something more like get back to things that you love and miss. Curious, does that resonate with some of your findings as well? And have you thought about that word normal or your use of the word normal?
I can talk a little to this. I've probably seen the same. First of all, This Is Our Shot. I know we've partnered before, so thank you for joining today. We've probably seen some of the similar research, and I can't cite a data point. I don't know if Crystal or Alex had, but I can say that based on similar feedback and a kind of a similar approach, we at least tend to avoid the word normal too much in our messaging. We focus a little bit more on made to save, or getting back to the moments we miss and the things we miss the most, because I think everybody can sort of relate to something that they miss about before the pandemic. But for those exact same reasons, we don't lean too heavily on the normal framing and like what that means. It means different things to different people.
Yeah, same. We're happy to provide the exact text of the messages that we tested, but I believe that we deliberately left, even though the message is called back to normal, we deliberately left that word out of the text that was tested, and we just talked about the activities and some of the examples of things that constitute quote normal life for many people.
Yeah, that's great, Crystal. We did actually have one other person ask about getting the specific text that we use, so we'll provide that in the email follow-up. I did have one other question here also about kind of maybe taking a step earlier in the process. So where did the core themes even come from? So like, how do you sit down to come up with what the possible themes are that you'd want to put into the test? Is there anything, any tips or tricks you have on how to decide where to start?
Frankly, we just cast a wide net, and after as personally as someone who's managing this type of effort, I'm in communication with a bunch of people, both inside and outside of government, and I would just frequently, get their thoughts and opinions on what are the potential, tracks we could go down, and then, develop those so that we are, creating a very distinct messages. Kind of piggybacking to the back to normal, we tested two different ones where it talks about getting back together with your friends and family, or getting back to your daily life and some of activities, and we got two completely different results. So we were just very careful to cast a wide net and engage stakeholders early.
Mm-hmm.
That's a great point, Alex. And because you've been doing this for so long, do you find that it kind of snowballs on itself, that like the learnings that you had from previous tests actually help to inform your current tests and so on and so forth, so that those investments that you've made actually pay off even longer over time, not just necessarily for the one test you're focusing on?
Yeah, absolutely. We've done the vaccine message test was our third. We did one on masks, we did one on contact tracing, and we found parallels through all three, where talking about personal benefits versus collective benefits really works for Illinois residents. And we just really value it being specific to our audience. Just knowing that that's who we're trying to help make good decisions.
Yeah, I think earlier in the pandemic, Alex, that first mask wearing message test that we ran together, one of the messages featured, you should wear a mask because it helps your grandmother. And a lot of the guidance at the time, especially, was talking about like protect others, wear a mask, not just because it protects you, but it protects people who are more vulnerable. And so it seems to carry over that guidance, that personal benefit is more persuasive than protecting others, not just from masks, but to COVID vaccine.
I think we've got time for one more quick question, and then we'll wrap it up with some final thoughts. So it seems like everything we do is influenced by political party these days, whether we necessarily like that or not. And I saw that we looked at that when it came to the message testing. But looking back to the trusted source as well, did political affiliation have an impact on the trusted source? Did we look at that when we were looking at those trusted sources?
We did look at it from our perspective. Crystal, I'll let you go into the details, but from my recollection, it wasn't significantly different.
Yeah, it's going to say the same thing. Part of that is that there is a lot of correlation between the different groups. So we had 6 different distinct groups, but like I mentioned, many people don't fit it just neatly into one category.
Right.
And so, is it driven by political affiliation, or is it driven by income, education, other demographic information? It's hard to say. And so when we think about outreach, we have to think about what is the organization's most powerful lever to conduct that outreach. Can they target by political affiliation, or is it easier to target logistically from a geographic lens or another demographic category?
Yeah, that makes sense. And I want to thank all the attendees for the great questions. But unfortunately, we have a few more that we'll get to in the email that we send next week. But Abdullah, maybe you can take us to the next slide, and we'll just go through kind of quick key takeaways or final thoughts.
It was hard to just boil this down to one key takeaway. So for me, I don't think this can be overemphasized enough, the importance of good measurement and testing, and doing that over and over and over again consistently throughout, because like I've said several times now, things change, the environment changes, attitudes change, who you want to reach out to changes. Of course, you don't want to get yourself into a place where you're just stuck in analysis paralysis and not taking action on those insights. But we find that the organizations we work with are much more likely to want to operate on gut feeling and limited data, more so than over analyzing and collecting more data. So that would be my guidance.
Couldn't agree more with Crystal. And it's a reason why we've had 12 different research projects probably through the length of this now. But a key takeaway from my perspective as someone in state government is really casting a wide net and understanding different people's perspectives before actually deploying a message test or a survey, because there are a lot of histories and backgrounds and conversations that other people are having that really will lead to a lot of great insight, and then you could go put it to the test and see whose idea is best, and then go forward with that and have the greatest impact.
Yeah, I would, I echo a lot of what both Crystal and Alex said, but in particular, I think Alex, mine is very similar to yours, which is I'm a big believer, obviously, of a career in data and analytics, and a big believer in quantitative research, but I think it's strengthened with more qualitative, and that the best plans include both. And so really engaging with and talking to people, partners, especially those that are from or engaged in the communities that you're trying to reach, is only going to make your ultimate tests and research better and stronger as you get that insights and input and the ideas you maybe wouldn't have had otherwise.
Fantastic. All three of you, thank you so much. Grazie, I'll say it probably not very well, but I'll say it anyway. Really appreciate your time and walking us through these great insights. For everybody joining us today, thank you as well. We'll share the results and the recording of this and have the report ready on Monday to share out as well. So if you have any questions, you can always reach us at hello@civisanalytics.com. And I think that's it for today. Thanks, everybody.
Thank you.
Thanks.